You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with gum disease. My first guest is an expert on the topic, Dr. Gregory Dilger. Dr. Dilger, welcome to the program.
Randy, thank you very much. Nice to be here.
Now, before we get into today's topic, tell me about your practice. I guess you do more than gum disease and more than just dental implants.
You know, Randy, we do, and I'm very, very proud of my practice. We are a general practice. We do all aspects of dentistry, primarily treating adults because that's where my primary focus is, but I really, really enjoy doing cosmetic dentistry, making people beautiful, giving them the smile that they want, and for me, treating the gum tissue and making it healthy is a big part of the cosmetics.
Your office, though, I mean, you are into technology, all the new stuff in your office. Tell me about that.
Randy, I have always enjoyed high-tech, new things. My first laser I had 15 years ago when I had my digital x-rays put in, computerized x-rays. They flew a guy up from New York because they'd never put a network system in the country before.
So you were one of the first guys in Oregon to have that?
Absolutely. One of the first guys in the country to have a network system for x-rays, so I'd have computers in every operatory with my x-rays on there.
Now, you know, we have doctors from all over the country, Canada, that fly in here, and I interview a lot of dentists from all over the country, and you are the first one I've ever met that uses a microscope for just about every procedure. Expand on that.
I use my microscope all the time. I'm at the point where I can't even look in the mouth without a microscope. And it's not because I can't see, but it's because I can see so much better with the microscope.
But don't all dentists are using microscopes on their glasses, aren't they?
All dentists are using, most every dentist is using a telescope on their glass, the little lenses.
Okay.
And if you look at that, one about this big will be 1.5. You get the ones that look like they're super long, and those are about 3x magnification. With my microscope, I traditionally work at 10x magnification, and I can go up to 25x magnification.
Interesting.
So it's a large order of magnitude.
So it makes it more precise?
It makes
less mistakes?
Makes me able to see what's going on in the mouth at a much higher level. Okay,
now you have this tooth in a day, or this, I hope I'm pronouncing it right, CEREC machine. Tell me about this.
The CEREC has been a wonderful new technology. Came out 12 years ago, and we've had ours about 10 years.
And what is it? What does it do?
It's a computerized milling unit. So it's CAD/CAM for dentistry. We will go in and we will prepare the tooth for a restoration, and then instead of taking an impression for a crown and sending it to the lab, we will take the computer with an infrared digital camera and snap a picture. It then comes up on the computer screen, and I will design the restoration, the crown, the inlay, onlay. On that, the patient has the opportunity to watch that.
So a crown right there.
Crown right there.
So aside from convenience for the patient, is it more precise than sending it out to a lab?
It is tremendously convenient for the patient. But the reason I started with the CEREC, and I got my CEREC a year after I got my microscopes, is because I was not happy with the restorations I was getting back from the laboratory.
Meaning what? What does that mean? You're not happy?
I wanted something more precise.
So they didn't fit properly?
They did not fit as well as I wanted them to, looking at it underneath the microscope.
So these will last longer? Is that the whole idea?
So these should last longer.
Okay.
When you look at the materials and you look at the porcelain on the CEREC restoration wears so much closer to natural tooth structure than the porcelain we get on the porcelain-fused metal crowns from the laboratory.
Now, I've got a list of questions about gum disease, but do people still tell you, you know, I hate going to the dentist, or I don't like going to the dentist? I mean, do you ever hear that?
You know, Randy, I don't hear that more than about once an hour in my practice.
Is that right?
Yeah.
How do they say it? They just come right out and say it?
It's, no offense, doctor, but I don't like to be here.
Really?
And we have spent so much time and effort in our practice making the office beautiful. We have saltwater fish tanks to help the patients become more comfortable. We still hear it. They don't like to be there.
Really? Now, once they go there, I mean, this is more so with new patients.
First-time patients.
Okay.
Once the patients come to our practice, they enjoy watching their fish. And with the microscope, we have little cameras in there, feed a monitor on the ceiling. And
they look in their mouth.
And they get to see that. So as soon as I push the button to bring them back, they're looking directly up to that monitor.
So that's rare, right? I've never seen that before.
Not many people have.
So this is one of the most high-tech offices, then, you can pretty much get.
Yes.
Is that fair to say?
Yes.
Okay, good. All right. And does that mean lower downtime for the patients, less pain involved, things like that?
What the benefit to the patient is more precise dentistry that is more cosmetic and dentistry that is more convenient and comfortable for them.
So moving on to gum disease, first of all, let's define it, and how big of a problem is it?
Let's talk about how big of a problem it is. Most dentists do not have gum disease. Most hygienists do not have gum disease. Most everybody else in the population has a level of gum disease. And gum disease is primarily characterized by bleeding in the gum tissue, red, swollen, puffy gum tissue. The teeth may become loose, bad breath, a bad taste in your mouth. You may actually see some form of exudate coming out from around the gum tissue.
So bleeding gums even from just flossing? I mean, that's okay. Isn't that normal, though, a little bit of bleeding gums?
That is common, but it's not normal and certainly not healthy.
Okay.
Many people will have bleeding gums when they brush. You will see people that have bleeding gums when they eat. None of this is normal, none of it is healthy. And it is very similar to if you washed your hands and your hands started bleeding.
Okay, sounds like an exaggeration though, really.
It sounds like an exaggeration because that's not common, but my gums do not bleed.
All right.
I brush, floss, pick aggressively, they don't bleed.
On the internet, 17 million Americans wearing an upper or lower denture. Does it all start with this gum disease, with the bleeding gums, with the puffy gums, etc.? I mean, is that what's going on? Is that what kills the tooth? Or
people will lose teeth for a variety of reasons. But the only way you're going to lose all your teeth is through gum disease.
Okay.
It is a huge problem in our country.
Okay, help me understand that. Okay, so people watching this, okay, so they have bleeding gums, maybe they're in their late 30s, 40s, puffiness, bad breath, things like that. Where are they headed? What's going on? I mean, what's happening under, I guess, the gum line, around the tooth?
Okay, so we'll talk a little bit about the mechanism here. Gum disease is a bacterial disease. The bacteria is harbored in the gum tissue, and it's not removed on a daily basis.
Is it an infection, would you call it?
It is an infection.
Interesting.
It is an infection. When it's not removed on a daily basis, they proliferate right along the gum line. And that proliferation causes toxins to pour down into the area between the tooth and the gum. These toxins contaminate the tissue. They cause the tissue to have an inflammatory response. That's where you get the red swelling and the increase in bleeding. As these toxins accumulate down there, the body, with its bone, the bacteria will attack the bone and destroy it. The body is also constantly resorbing bone, but the body cannot lay new bone down.
So the tooth starts to get loose?
Right.
But why the bleeding, though?
Because of the inflammatory response. The body is trying to fight this infection. It's sending every resource it can to this area to try and fight the infection off.
So the goal is to catch it early, obviously.
The goal is to catch it early.
Is that tough to get people in to do this early?
Yes.
Do they wait, especially men, wait until it's too late?
Everybody waits. Not everybody till it's too late, but definitely till it's longer than it should be. Because if we can catch this early, and we talk with teenagers about this all the time, how to brush, how to floss, why to brush, why to floss, what to look for, how you can judge whether you're doing a good job. Because it's very, very important to catch it at the earliest stages.
So I guess the good news is that there's a new laser that we're talking about today.
Yes.
That takes care of this, and we're traditionally, I guess, or even done today, with surgery. They're cutting it out.
They're cutting it out.
Okay, so let's talk
So
about it.
Gum disease in traditional has been treated in some very conservative ways where we have scaled and root planed cleaning with anesthesia very deep into the gum tissue, and it is effective to a degree, but does not eradicate the disease. The other aspect for traditional treatment is a cutting surgery, where the periodontist, the gum specialist, will actually go in and cut the gum tissue away from the tooth and the bone, scrape the teeth to get all the tartar or calculus off, remodel the bone, take burrs and actually shape the bone around there, cut off the excess gum tissue, and then sew the gum tissue back down around the teeth. What happens after this is done is, one, there's a fairly good level of discomfort for the patient. They're always put on pain medication. They'll do 1/4 of the mouth at a time, so you have 4 different appointments to treat the whole mouth. And when the healing is all done, the gum tissue has moved down the tooth a considerable degree. And when you start talking about aesthetics, instead of nice teeth that come out of healthy pink gums, you have very long teeth out of pink gums with dark black triangles between them.
Okay, so I understand this correctly. And I looked at a video on the internet about this. So you have a diseased tooth. You have, so it's scraped off. They cut the gum tissue. This is how gum disease is normally treated, so I understand this correctly. They cut it out, put some stitches in certain cases, and then the patient has to heal, and then their tooth appears longer because they cut away some of the gums.
Right.
You're saying that now there's a laser.
With the laser, we have a completely different approach. Our goal with the laser is to eradicate the bacteria, eradicate the diseased tissue, maintain the healthy tissue, and maintain the tissue that has the building blocks to rebuild the gum tissue around the tooth.
Okay. So how does it work? I mean, how does it work? When you say eradicate, are you talking about it kills this infection?
It actually will kill the bacteria.
All right.
Okay, that is in the pocket. It will also, the term is ablate, or make disappear.